I'm Jack Hatch, State Senator from Des Moines, Iowa. I've got really two tasks. Here I'm to gather information from my state on the health care reform proposals, not only going on in Congress, but some of the discussions going on here with other states. It's helpful to us as individuals to get this kind of feedback and to deal with people who are like minds, and to be able to take some of that and push it into our own state legislative reforms. Secondly, I'm here as chair of the White House Working Group for State Legislators for Reform to be able to synthesize what's going on in Washington and try to move an agenda of a progressive position for the President's plan for health care reform, where we want real accountability, real affordability, real access, and that includes a national health insurance plan option. That's real important for not only states, for our constituents, because we understand that if health insurance was available to everybody, then everyone would have health insurance. But there's obviously 50 million Americans don't have it because they can't afford it, and they can't afford it because it's too expensive, and those costs aren't coming down. So the only way to get a health insurance coverage to those Americans that don't have it, that need it, is to provide an option that may be not as many benefits as private insurance, but benefits that provide the health care that they need, that focus on preventive care, chronic disease management, where we can get a better system for all Americans. And that really means that besides all the talk about a national health plan, cost containment, access to health insurance and to health care, we really need to have a delivery system that is going to move us from a sick care system to a real health care system. Meaning we don't need to be, our costs are so high, it's because we're treating people when they're sick. When health care to me means let's treat people when they're healthy to keep them healthy. Let's engage in preventive care, shared responsibilities, so we don't have the obesity rates in young children that we never had before, but we do now because of our health styles, and because kids aren't going to the doctors only until they're sick, and they should be going to get counseling in a much better form. So we've had an opportunity not only to provide health care to all Americans, but get a new direction in how our health care is delivered. So that's what we're doing here today.